Good evening, everyone, and welcome to tonight's long-term care family call. Today is April 5th, and the call this evening will be running from 7 p.m. to about 8 p.m. Just going to read this disclaimer. Wednesday, April 5th, 2023. This video discusses matters related to residents of long-term care homes operated by the County of Grey. Please feel free to share this video with others in the Grey County community. If you have a family member in a long-term care home not operated by Grey County, please contact that home if you have any questions or concerns about their care. So joining us tonight is Jennifer Cornell, who is our Director of Long-Term Care, as well as Dana Leach, who is our long-term care clinical specialist, and she'll be here to answer some of the questions this evening that might come up in our Q&A. And on that note, just a reminder that all questions will be funneled through our Q&A feature on Zoom, not the comment section. So if you have any questions, please feel free to use this feature to type in your questions located either at the bottom of your screen if you have a laptop or a desktop, or the Q&A feature can be found at the top of your screen if you're using a cell phone to watch tonight's call. After Jennifer Cornell's update, we will open the floor to those Q&A questions. So now I will pass everything on to Jen. Good evening, Jen.
Great, thanks. Thanks so much, Olivia. I did just get a note, so we'll maybe just note when we send this out that some people are finding the link is expired, and I'm not sure, perhaps in one of the reminders. So if that's turns out to be a challenge for a lot of people, then we will just circulate. We always circulate the information after the call. So apologies if that's the case. So as Olivia mentioned, this presentation is intended for the family and loved ones of the residents of the Grey County long-term care homes. We do encourage you to share this with others in your community. And for those viewing who have family members in other long-term care homes, please understand that this information is only related to our Grey County homes. So thank you so much for joining us this evening, and I will get started on the update. We last met virtually on November 2nd, and I had to do a double check to see if that was the case, and I just can't believe how time flies. So I'll just get right into it. This season of respiratory illness was particularly challenging and was referred to as the viral trifecta or triple threat with COVID-19, influenza, RSV, and we also saw lots of instances of varieties of the common cold. As you know, all three homes managed a variety of outbreaks over the past months, and we thank the residents, team members, and all of you for your support throughout. Since last fall, we've seen all three homes support the de-escalation of a variety of pandemic strategies while still balancing the risk of infection and outbreak. And in this update, I'll review the recent changes that were released on March 22nd, announced by the Ministry of Long-Term Care, and a couple of non-pandemic items, a short redevelopment update for Rockwood Terrace, and I want to touch base a little bit about the Designated Care Partner Program. So on March 22nd, the Chief Medical Officer of Health announced that Ontario is taking a phased approach to updating the COVID-19 measures for people living in and working in and visiting long-term care homes. They released a memo and on March 22nd, having the measures come into effect on March 31st. And here's the rundown of the changes. Asymptomatic screen testing, which we refer to often as our rapid testing. So the ministry no longer requires asymptomatic screen testing or rapid antigen testing of staff, students, volunteers, support workers, caregivers, or visitors. And just so that all of you know, as part of our de-escalation measures, We are leaving one testing station in place in each of the homes for a period of time for individuals who would like to continue to self-test. So there may be people, there may be staff, there may be visitors who think, oh, I'd really like to just do a rapid test on my way in. And so we'll leave those stations up for a period of time. Outdoor masking. The ministry has removed the recommendation for residents, caregivers, and visitors to mask outdoors. Masking will remain in place for staff outdoors when they're in close proximity to a resident. Indoor masking. Indoor masking requirements remain in place for staff, students, support workers, and volunteers. All caregivers and general visitors are required to wear a mask when in a common area or a shared space of the home, and are recommended to wear a mask when in a resident's room. We ask that unvaccinated visitors always wear their mask and only visit with their loved one. Resident screening and daily temperature checks. Long-term care homes will continue to be required to monitor residents daily. So we do that every time we are interacting with someone. There's an assessment going on to detect the presence of infection, including COVID-19. However, daily temperature checks for COVID-19 are no longer required. Resident absence. Homes are no longer required to actively screen, test, or isolate residents that are returning from an absence unless they have symptoms or have tested positive for COVID-19. Screening. The act of screening recommendation for visitors and caregivers has been removed and replaced with passive screening requirements for staff, visitors, and caregivers. You'll see in each of our homes that we'll continue to have a screener on site to support this transition until April 12th. I'd also just like to take a moment to remind everyone that visitors are still required to sign in and out every time they visit. Visitors during outbreaks. The limit of one caregiver at a time during a COVID-19 outbreak or when a resident is symptomatic or isolating has been removed. During an outbreak, long-term care homes continue to be subject to public health unit direction as per the ministry guidance. So the blanket approach of a limit of one person at a time during an outbreak, that's been lifted. Having said that, public health gives us our direction in terms of how to manage and best manage an outbreak. And that's always based on the situation at the time, the outbreak at the time. And so we'll communicate that information when we face an outbreak. We'll continue to do what we've done in the past and communicate what the restrictions are and what that means. Activities and physical distancing. Long-term care homes are now able to hold activities without adjusting to optimize for physical distancing. Vaccination plans and policy. So we're continuing to evaluate our policy on vaccination requirements for staff and designated care partners, and we will communicate an update as soon as it's available. Vaccinations will continue to be available at the home for residents, staff, and designated care partners, and vaccinations continue to be recommended by public health officials. I have received a few questions looking for clear information and a clear statement regarding unvaccinated visitors. So we are, with the screening requirements being lifted, so we're no longer having a person at the door asking all those questions. That means we're no longer asking for vaccination status. So while we won't be actively monitoring it, we are asking that if you're an unvaccinated visitor, that you wear your mask at all times and that you visit only with your loved one. And that's really just to take into consideration that people have differing opinions about vaccination, and some residents and family members would prefer to continue to be masked when everybody is kind of mixed together. So just ask, and this is a trust exercise. We're not going to be monitoring it, but this is an approach that we're suggesting. In addition to all of this, we've added an additional layer of support with 3 IPAC leaders. Each are dedicated to a home where it's their primary responsibility to ensure that we have a robust and sustainable infection prevention and control program. And we're really thrilled to welcome these new leaders to our organization. And so just some gentle reminders that were in place prior to the pandemic and will continue to be in place going forward. Hand hygiene, hand hygiene, hand hygiene. A reminder to check in advance with staff when residents are going out so that medications and other arrangements can be made, and a reminder that residents must sign out. Don't visit if you're not feeling well. Finally, I'd just like to say that I appreciate and understand that this change of winding things down may be concerning for some people. Some people are thinking this is great, it's about time, and some people are really worried. So I do want to remind us all that everyone who's in the building will have reviewed the passive screening questions. They're well-versed in IPAC strategies like hand hygiene, and most importantly, they care about the health and safety of the people that they're coming to visit. And that's the summary regarding the recent COVID changes. So just to touch a little bit about the redevelopment update at Rockwood Terrace. On March 23rd, Grey County Council discussed the Rockwood Terrace redevelopment project. The ministry requires Rockwood to be redeveloped by 2025 and has approved a total of 128 beds for a new build located in Durham. At that meeting, Council set an upper limit for the project of $92 million, which falls short of the most recent cost projections for the original design of the full campus of care. So inflationary pressures and higher interest rates are impacting the cost of the Rockwood Terrace redevelopment project. Grey County is committed to moving the project forward, and Council is committed to respecting the limits of what is affordable for ratepayers. Since that decision, we've been focusing on updating the proposed design of the project to reflect the budget of $92 million. We're working with the project design team, project manager, and design architects to reimagine the project. This will cause some delays in the project timelines, but it's an important step moving forward. And I do really want to emphasize that Grey County Council remains committed to providing long-term care services in Durham. We'll ensure that new information is shared with staff and the broader community once it's available. And I wanted to touch base on our designated care partner project and program. Originally, this program was designed as a response to the visiting restrictions that happened at the beginning of the pandemic, and it has been proven to be a very successful program in ensuring that family caregivers were never completely locked out of long-term care homes again. As you know, we were part of a research project focused on assessing the value of designated care partner or essential caregiver programs. And it's not surprising that the evidence shows what we all know, that essential caregivers are essential. So we are continuing to evolve the program so that our DCPs can become embedded as part of our care teams. DCPs, designated care partners, provide support for residents, support for staff by bringing important information and insights into the needs of their loved one, and help work together to create solutions and plans of care that are truly centered on each individual. As part of the research project, we had a chance to be part of an information video. There are two versions, a longer video and a shorter video, and I'd like to share the short video now. And I think you'll see a lot of familiar faces. And so I'll pass it over to Olivia for a moment, and she's going to launch the video.
Thanks, Jen. It'll just take one moment. Jen, if you don't mind, I'm going to start playing the video for our viewers. And if you could let me know if you could hear it on your end, that would be great.
Family presence in long-term care has...
You can hear that?
Yep, it sounds great.
Wonderful. Thank you so much.
really gone for decades as an unacknowledged contribution to people that are living in long-term care. People move in and they become a resident, and they still depend on and look forward to and rely on the people in their lives from before they lived in long-term care. And it was really during the pandemic that there became a formal acknowledgement of the contribution of family members and friends and just how important those people are to the people who live in long-term care. Designated care partners, or DCPs, as we call them here at Bruyere, are also called essential care partners, ECPs, and other organizations. And what they are family members, friends, anyone the resident feels comfortable to have come in and be part of their care team to provide different aspects of their care. The difference between a visitor and a DCP or essential care partner role comes down to many things, one being training. So they're learning about the rules, learning how to do things safely. It gives them a sense of responsibility, they have a sense of accountability, and they're members of the team. They're not there to replace staff, they're working with the staff to provide the best care possible for their loved one.
They are a valuable member of the team. That by becoming a DCP or a designated care partner, you end up being not just a visitor. It doesn't mean that you have to come in and dress and bathe and all those cares, but your level of comfort and where you would like to have your visit begin and end, we can do that with the DCP program.
Essential care partners are essential because they are the connection between the resident and the support team that's here. It's an advocate, it's a loved one, it's someone who knows the resident best.
There are a number of key findings from our research, and I would say the first is the very simple but important finding that essential care partners are essential. When essential care partners are barred from the home, there are declines in well-being. When they're allowed back in, things improve. The most dramatic example of this that we found had to do with people living with dementia, people living with Alzheimer's in long-term care homes.
I don't think any of us knew the extent of the importance until the pandemic. For someone who had Alzheimer's disease or anyone with dementia, he's already isolated, isn't he, in his own little cocoon until that magic moment when we could get together because of the DCP program. It's just the magic of connection, and it was pure joy. It's also important to know how much you'll receive yourself from the experience. Continuing your memories, and you'd be surprised how much you get back yourself, not only with the resident that you care so much about and you're visiting, but others who are there too, if you're able to just let them know that you see them and you're interested in their welfare.
You always see the joy in their face for them to actually be granted that access. For example, the couples that have been together the longest, they haven't been away from their loved one for the last 40 years they've been together. Navigating all that stuff, even when it's very onerous, they have to get tested to come into the residence, but they understand that it all comes down to protecting the loved one, but also to guaranteeing that continued connection with the loved ones.
I see an opportunity for us to take that into the future so that it isn't just about how do we have people safely visiting during an outbreak, but how do we have residents, family members, and friends as part of the care team for the time that they live in long-term care. Essential caregivers or designated care partners, and there's different names, but it's all this formal acknowledgement of someone that the resident designates from outside the community as part of their care team. Care partners, residents, team members, which is our words for staff, they all play a role in developing our programs and our policies. And we're always looking at opportunities to include the DCPs in the day-to-day care and planning for the experience of people who live here. Family presence and friend presence in the home makes a place a community and a home, not just a long-term care facility. It's a place where people live. It's a place to find joy. It's a place that we want to give people a life worth living.
Thank you. I'm so pleased that so many of our DCPs and team members were interested in being a part of that video. And if you're interested in the longer version, it's 11 minutes. We'll link it. And I just received notice that there's actually a third version that really focuses on the research findings, and it's more of Dr. Conklin talking about the outcomes of the research. And we can link all three for everyone. So if you're a DCP and you're asking yourself now that there are no longer the testing and visiting restrictions, should I continue to be a DCP? I want you to think about how your role as a DCP might continue to support and improve the quality of life and the quality of care for your loved one living in long-term care. And we will be reaching out with a survey so that we can co-design the next evolution of our care program. And I would just like to share that, and I've said this before, but the Grey County Designated Care Partner Group were really pioneers in this work. And I was just invited to a presentation today about an essential care partner hub, collaborative hub, where there were 200 people participating to learn about how they might implement a similar program in their long-term care home in their hospital. And so that's it's pretty exciting and things we should be proud of. So that was a lot of information, and now we can look to see if there are any questions.
Thanks, Jen. Yeah, we do have one question in the Q&A, and just as a reminder for those who popped in a little bit later, please use the Q&A feature below. It is much easier to keep track of rather than using the chat. So the Q&A, please. So our first question is asking about, am I correct in thinking that I no longer need to schedule an in-person visit with my loved one?
That is correct. And we have been working to update the website so that those links are adjusted. We were having some technical difficulties last week with some of our links on the website, but that's been sorted out. So you shouldn't even see those options anymore to be able to book those. So you don't need to do that. You can come in, sign in. It's important. It's an important part of our visitor policy for safety, and it's required under the Act that we have a process for tracking and documenting people that are coming and going from the home. So there's a sign-in book. Usually it's near the front entrance, and it will have the passive screening questions. So it'll have all those questions about, are you sick, essentially? Do you have this symptom or that symptom? And so you answer all the questions, and then on the other side, you put the date, your name, your signature, who you're going to see, and then you sign out on your way out.
Okay. At the moment, we don't have any more questions, but we can wait a minute or two if you wish to let people have the opportunity to type in a question to the Q&A. Oh, we do have another one that just popped up. It says, are unvaccinated visitors allowed in the residence room while wearing a mask?
Yes. So it's a great question. Thank you. And I've had a few emails about this. So there does still seem to be a little bit of worry and confusion. And that's, I mean, we've been doing these strategies for 3 years. And, you know, on March 22nd, we get a memo that by Friday, March 31st, wind it all down. So it's a big adjustment, and it's going to take a bit of time. So we're working hard to make sure that it's clearly communicated with all of our team members. But we're talking about 600 people across 3 locations. And so we're doing our best to get the information out, but it will take a little bit of time. If you find you're getting mixed messaging at the home, just ask to speak with one of the members of the leadership team, the resident family services manager, registered staff, and we'll be able to get that sorted out for you. But to clearly answer your question, there is no restriction for visiting, regardless of your vaccination status, and you can visit in the residence room. And we are just asking you to keep your mask on. That actually isn't stipulated in the ministry guidance. When you're in a room with your person, people can take their masks off. We are asking you to consider keeping your mask on if you're unvaccinated.
Next question we have, specifically addressing Jen. Do you see in the near future we could eat with our loved ones somewhere other than their room? As well as also, there have been times others have wanted to join us. So I'm assuming it's other residents. What are your thoughts on that?
Yeah, that's a good question. And the team, we were talking about that today. Some of it is still a bit unknown in terms of specific guidance. And so again, we've gone from a world of here are all the rules and we're going to outline every single rule to every single detail to here's a broad suggestion and you need to do your own risk assessments and make your own decisions. So we have reached out to the ministry and to our partners at Public Health to get a little bit more guidance on that. Right now, people can take their mask off, have a coffee, share a cookie or a sweet. I mean, this is what I would do. You could have healthy food, but you can do that in the room with your resident. In terms of eating in the dining room together or eating in one of our kind of family spaces, we don't have a definitive answer on that, but we are actively looking to be able to make a decision. And I suspect we'll still use our risk assessment. So if we've just got out of outbreak, we might be a little bit more risk averse and talk about what the options are. If things have been going along great and we have clearance from the province and Public Health, well, then we can talk about how many people, who else is there, how are we going to screen, can we have some assurity that if you're feeling a bit sick, those folks are going to stay home, that kind of stuff. Dana, did you have anything you wanted to add to that?
Yeah, and for sure, Jen, if people can, certainly accompany mealtimes are a really social time. So if you want to accompany your loved one to the dining room, that's absolutely within the realm of what we can support, but we definitely need the mask on. But I anticipate too, we'll hear more, but at this point, it is restricted for with meal times, minus that subtle quick snack, take his sip of your coffee or what have you, and mask go back on, particularly for those at this point that are unvaccinated.
Thank you so much, Jen and Dana. So our next question, actually, it's less than a question, more of a thank you. One of our attendees says, I want to say a big thank you, especially to Rockwood Terrace for keeping the residents and DCPs safe. As I continue to say, Rockwood Terrace rocks. That's very wonderful, very appreciated comment. Thank you so much. Moving on to another question. When do you think we can eliminate masks?
Yeah, I don't know. And I see the next question speaks to that too. Do we see a future that masks might be absent at long-term care? And I don't know. I've heard mixed thoughts on this. And Dana, have you heard?
Yeah, we are, as you know, I had the opportunity to participate on that PIDAC forum, Provincial Infectious Disease group. And I mean, that's a question not only for families, but it's for staff, it's for all of us wondering what it'll look like. And I think at least as we go into this, the World Health Organization hasn't declared us over, although we are seeing it endemic. I think we may indeed see it for another 6 months, but we may see masks come more frequently during respiratory seasons. That's where we're taking a look, where we may all of a sudden, if we know there's a respiratory season coming, we may indeed need them. So I don't think they're a tool that'll be out of too far away from our toolbox in the near future. But
yeah, thanks. Maybe we can imagine a time where it's summer and people are pretty healthy, and maybe we're not wearing masks in the heat of summer, but then as we get to flu season, it's something we start to bring back. And okay, so stay tuned. We're lucky to have
it's definitely on the radar. It's definitely questions we're asking, and as soon as we find that information, we'll be sure to share. There'll be a lot of people pleased with it. while also still keeping, as I said, masks have been a really good tool.
Yeah, that's great.
Thank you so much. Next question is there a best time for a visit during the day? Or perhaps times to avoid? And I'm not sure if they had a specific home that they would like you to answer that for, or just the homes in general.
Well, no, that's a great question. And so my background is resident family services, and I used to help support people moving in. And I used to say the great thing about long-term care is that there's no visiting hours. So as long as you're not having a wild party and keeping everybody up in the home area, and I think that still rings true. I think that if you are hoping to speak with a registered staff, there are times that are busier. I mean, I think everybody's pretty busy all the time, but there are times that are busier than others. So shift change can be kind of a hectic time, and that's usually between 2 and 3:30. So shift time. If a nurse has his or her head down and they're in the middle of a med pass, that can be a pretty busy time. But I'm waiting to see if my call a friend lights up, and some of my colleagues give me some specific suggestions. But I think that's, again, we try to keep things as home-like as possible. And with these changes and restrictions, that some of that freedom is really coming back. People aren't needing to come early to be able to, spend the time to do their rapid testing, and it's going to feel a bit weird just walking in the door and doing your passive screening and then carrying on.
That's what staff has said for sure, but I would suggest that the best time to visit during the day is when the pony is there, because I tell you, I don't know, that seems to be quite what smiles that had. So for anyone on the call that didn't see any pictures, please ask for them. They were in the newsletter. But anytime there's activities, that is a good time of day, and you can join your loved one with all of those activities. Again, just pretty awesome adventures going on every day.
That's wonderful. Just a comment from the communications side, if anyone listening has the Grey County corporate social media, if they have anything that you would like to see, we always are posting those fantastic stories from our long-term care home, whether it's ponies walking through and giving everyone smiles, or the wonderful events that are always being run by the fantastic staff. I think it was Hawaiian Day recently as well, and that was just wonderful to see. Anyway, so moving on to the next question. We have an individual asking, saying, I will miss the screeners. They have done an amazing job. I hope they have been recognized for their amazing service. Potentially, I'm not sure if you want to answer any questions about service recognition, or just thanking anybody on our staff.
I just say thanks for making that comment, and we'll be sure to pass it along. And I would love to share that I'm sure that you all know that we've continued to struggle with Health Human Resources during the pandemic, and across not just us, but across the province, and I'd suggest the world. And many of the people that were doing the screening and assisting with the rapid testing centers are people that had never worked in long-term care before, but put their hand up and said, I can answer the call and be an emergency support worker, that then became a care support assistant, and then took an opportunity to participate in training and education and became personal support workers or food service workers. And just out of the last cohort of a program that was offered by the Y Employment Services, Georgian College, and the Grey Bruce long-term care homes, there were 37 individuals who graduated with their PSW certificate, and every single one of them is employed in a long-term care home or health field in Grey County or Bruce County, every single one of them. So they put their hand up to the call. They said, hey, I like this. I am good at this job, and I can see a career here. And we have, I think there were 5 of those students that work in our 3 long-term care homes. And I got to go to the celebration, and it was such an amazing graduation, an amazing celebration. So I'm hoping that not only do those individuals feel appreciated for the work that they did, but also see an opportunity for a career in our homes and in long-term care. And we want to support them in doing that. So thank you for making that comment.
Another question that has come up, it reads, can visitors have lunch with a resident? Specifically order and pay for whatever is on the menu that day?
This is a really good question, and I don't recall this. That it's been a while since we
haven't implemented it. We talked with at this point where we have not implemented. And
okay, this was a thing definitely that was pre-pandemic. So we will take that. I'm going to assume that the question is a desire to look at that as an option, and so we'll take that back and get back to everyone on that.
Another lovely comment we have, rather than a question, but always appreciated. It reads, thank you, Rockwood, for all the fun activities that help make days more enjoyable. You all work so hard to keep the residents smiling. And from my side of things, you do. You really, really do. All of the long-term care staff, they're fantastic.
That's so nice. And I feel like Rockwood has maybe planted a few good supporters in the Q&A box. That's so great.
I think the other thing, Jen, with all of our 3 care communities is each of the activity departments, it's a collective. So if there's a great idea, it generates itself to another, and vice versa, sharing ideas and strategies. So there's a lot going on for sure.
Yeah, there is. Okay. So Olivia, I'm thinking that it is a small group today, which is great. I do know that I'll let you read that one. I do know that people watch the video, and then we get some emails with some questions after. So please don't hesitate to do that. I'll let Olivia read the last comment, and then I can do some closing remarks, and then we can follow up with the video in a day or 2.
Yeah, and Jen, if I could just sort of circle back to that meal question, I think it's 2 parts, right? So we just have to make sure that we're okay for everyone to be unmasked eating together. So that one is the one that's still in transition, that question. And then the second part is that if that's okay, then can we then look to our nutrition departments to see how if we're going to go ahead and offer the meal with that cost. So one probably has to happen. Well, one does have to happen before the other, but we'll be certainly working towards it. Asking.
To wrap up, I will read the last question that Jen pointed out. There was a lovely comment that said, Grey Gables is amazing with many, many A's. And
but now you have to do the other 2.
that is true. There was a comment that just said thank you for answering their questions. There was another one that said thank you to all the staff and volunteers at Lee Manor. I think they do a great job. This is the 3rd long-term care home I have had a loved one as a resident in the past few years. So that seems fantastic, wonderful that we're feeling the love very much so from the family members of our residents. There is one more comment, Jen, would you like me to address? Okay, so there is a comment that is a quite funny one, but it makes sense. just like with social hour and having food in our communities, in our long-term care homes, there is an individual asking if there will ever be alcoholic beverages available in our long-term care home to probably have a very nice and social time with their loved one. Is that a possibility for DCPs to have that? I'm not sure if they're asking about bringing something in or if that might be available in our kitchens.
Yeah, no, it's a great question. And we also have done that in the past as well. So when we do a follow-up, and it might not be circulated with the video, but we'll put this on the list that breaking bread and breaking this dry spell is important to people. And so we'll do some follow-up on that and revisit what our pre-pandemic policies were and do we need to make any changes going forward. But this is a whole bunch of adults and grown-ups spending time together, and so we can support that in a safe way.
All right, thank you very much for answering those questions. One final one, probably to wrap up the evening. Someone said, thank you for taking such good care of our loved ones. Your efforts and hard work is much appreciated. So resounding yes to that.
Thank you. And I will just say a few closing remarks. And it had been a bit of a long day today, and this was a really nice way to end the day. So thank you, everyone, for your questions and such kind comments, and we'll make sure that we pass those on to the team members. And so I just want to thank you again for your engagement and commitment to our residents, our team members, and our communities. It has been quite the 3-year journey, and I think that we need to see the winding down of these strategies as a celebration. We've learned a lot over the past 3 years, and we're ready and we're skilled to move into this new normal. And I really do mean the collective training and experience will serve us well as we move forward. We know we can quickly respond and react when we need to, while at the same time focus on living life to the fullest in each of our homes. And thank you so much, and have a wonderful evening.
Have a great evening, everyone. That's it for tonight, and you will receive updates from our long-term care homes after this meeting. Have a good night.